Recent study shows that kidney stones in kids doubled between 1997 to 2012. Of those cases, 52% are said to be girls. Researchers think too many sugary and caffeinated drinks could be the blame. There's also a higher risk if there's a family history of kidney disease. Let's talk about this with a doctor, Dr. Jeff Pothof from UW Health, the UW Health Chief Quality Officer, joining us live. Great to see you, Doc. I mean, when I think kidney stones, I think middle-aged white men, because that is what used to be the thought. That's who gets the kidney stones. But all of a sudden, we're seeing all these kids getting it. What's going on?
Yeah, you're absolutely right. I think, even as physicians, we typically think of kidney stones as an adult disease, but we are seeing an increased rate of kidney stones in children. Not as much in the very young children, but age, 12 to 17, 15 to 19, a big uptick in that. And they don't know for sure yet why the increase in kidney stones in that age group, but there's three theories out there. One is, what they're eating. So sugary drinks, that sugar can kind of get kind of solidified in the kidney. It can create, an environment where stone could be made. Likewise, with ultra-processed foods, lots of times there's lots of sodium in there. That sodium can increase the chance of a stone precipitating. Another thing they're looking at is use of antibiotics. We do have data that suggests some common antibiotics can increase your risk of kidney stone by 2 times. Sometimes kids get antibiotics for things that maybe they don't need them for. That might increase risk of kidney stone. And then lastly, we've got good data that attributes kidney stone formation, especially in the South, matching daily average high temperatures. And the idea there is folks get dehydrated when the heat is on. That can lead to kidney stones. That might be another reason we're seeing them in kids. But more research to come. But, kidney stones are painful. Not great to hear that kids are getting those.
I've had one, and I would not wish that pain on anyone. It's the worst. But bottom line, if you're a parent, just diet, right? That's the one thing that we definitely can do.
Yeah, I think definitely, diet, keep your kids well hydrated. And when you go to the pediatrician's office and say, hey, not sure you need antibiotics for this, go with that.
And I don't know why that's just a message for kids, because as someone who had a kidney stone, adults take that advice as well. That's good stuff. Hey, let's talk about what's happening in Europe. Deadly viral infections on the rise. It has some experts here in the U.S. worried. What should parents know about this?
Yeah, I think, the take-home message right now is that pediatricians are looking out for these enteroviruses, particularly echovirus 11. And enteroviruses are very common. There's over 100 of them. They often make kids sick, but usually not very sick, maybe a little bit of diarrhea. But there's been a number of instances, including 8 deaths in Europe, of a particular enterovirus called Echo 11 that is not just causing diarrhea and mild illness. It's actually leading to sepsis and organ failure. So this isn't a huge number of cases, but it's more than we would expect. And it's something that's now on the radar of pediatricians in the United States to be on the lookout for kids to see if what we're seeing in Europe starts to materialize here in the United States.
Yeah, something to watch. We don't have a lot of time here, but for the first time, a case of CTE has been identified in a former female professional athlete. It was an Australian rules football player at just 28 years old. I mean, that's when she died. CTE usually associated with former American football players. So this shows women, they're not immune to this.
No, I think, the only reason we haven't really seen it in a woman before is we probably haven't looked for it. I think CTE, chronic traumatic encephalopathy, associated with football players, leads to motor problems. It also leads to problems with depression, anxiety, suicidality, sometimes aggressive behavior. To think that we would find it in a woman playing Australian rules football where head trauma would be common, not surprising, and won't be the first case of CTE that's found in a woman. I think we're all certain of that.
Yeah, I'm just thinking of all the youth sports where concussions are high, soccer, cheerleading sometimes. So it's something that we really need to take seriously. Dr. Jeff Pothof, appreciate your time today.
Thank you.